Peptic ulcer disease, PUD, refers to open sores or lesions that develop in the lining of the stomach, the upper part of the small intestine, duodenum, or occasionally the lower esophagus. These ulcers occur when the protective mucus layer of the digestive tract becomes weakened or damaged, allowing stomach acid and digestive enzymes to erode the tissue underneath. PUD is a common gastrointestinal condition found worldwide and affects people of all ages, though adults experience it more frequently. Causes of peptic ulcer disease. The two leading causes of PUD are Helicobacter pylori, H. pylori, infection and long-term use of nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, aspirin, or naproxen. H. pylori, a spiral-shaped bacterium, colonizes the stomach lining. Over time, it disrupts the mucus layer and triggers inflammation, weakening the barrier that protects the stomach and duodenum from acid. This makes ulcer formation more likely. NSAIDs, on the other hand, block certain enzymes known as COX-1 and COX-2. While these enzymes help reduce inflammation and pain, they also maintain the stomach's natural defenses. When NSAIDs inhibit these enzymes, the stomach's protective mucus decreases, making the lining vulnerable to acid damage. Other contributing factors include excessive alcohol consumption, smoking, high stress levels, spicy foods, though they don't directly cause ulcers, they worsen symptoms, and rare conditions like Zollinger-Ellison syndrome, which causes excessive acid production. Types of peptic ulcers. Peptic ulcers can be of several types depending on their location. Gastric ulcers, found in the stomach lining. Duodenal ulcers, occur in the upper portion of the small intestine and are more common than gastric ulcers. Esophageal ulcers, develop in the lower part of the esophagus, often caused by acid reflux. Each type may present slightly different symptoms, but the overall mechanisms behind their formation are similar. Symptoms of peptic ulcer disease. The primary symptom of PUD is burning or gnawing abdominal pain, often located between the chest and the belly button. This pain may improve or worsen after eating. Some key symptoms include a feeling of fullness or bloating, heartburn or acid reflux, nausea or vomiting, loss of appetite, unexplained weight loss, dark or tarry stools, a sign of bleeding, vomiting blood or material that looks like coffee grounds. Duodenal ulcers typically cause pain when the stomach is empty, such as at night or early in the morning, and eating often brings relief. Gastric ulcers, however, may worsen with food intake. Diagnosis of peptic ulcers. Doctors diagnose PUD through a combination of medical history, physical examinations, and diagnostic tests. Common tests include endoscopy, a thin tube with a camera is inserted down the throat to visualize ulcers directly. H. pylori tests, these may include blood tests, breath tests, stool antigen tests, or biopsies taken during endoscopy. Upper GI series, barium swallow X-rays taken after the patient drinks a barium solution to highlight abnormalities. Endoscopy is the most accurate method because it allows direct visualization and the option to collect tissue samples. Treatment of peptic ulcer disease. Treatment focuses on relieving symptoms, healing the ulcer, and preventing complications. The plan depends on the cause. For H. pylori infection, doctors prescribe a combination of antibiotics along with acid-reducing medications. This regimen, known as triple therapy, typically includes 2 antibiotics and a proton pump inhibitor, PPI. For NSAID-induced ulcers, patients are advised to stop or reduce NSAID use. Doctors may prescribe PPIs or H2 blockers to lower stomach acid, allowing the ulcer to heal. Acid suppression. PPIs such as omeprazole or pantoprazole are the most effective acid-reducing medications. They help reduce irritation and promote healing. Antacids may provide temporary relief, while sucralfate can coat the ulcer and protect it from acid. Lifestyle modifications. Patients are encouraged to quit smoking, limit alcohol, reduce stress, and avoid foods that worsen symptoms. Eating smaller, frequent meals may also help. Complications of PUD. If left untreated, PUD can lead to serious complications, including bleeding ulcers, which may cause anemia, perforation, a hole in the stomach or intestine wall, gastric outlet obstruction, blocking food passage, infection of the abdominal cavity, peritonitis. These complications often require emergency treatment and can be life-threatening. Conclusion. Peptic ulcer disease is a common yet serious condition caused primarily by H. pylori infection and NSAID use. Understanding symptoms, seeking timely diagnosis, and following appropriate treatment are essential to prevent complications. With proper care, most ulcers heal effectively, and patients can return to normal life with improved digestive health.